Just to set this one up, guys, this is Fox and Friends, Monday morning, October 6th. Head of CDC, Fox and Friends.
And Dr. Tom Frieden. Good morning, Doctor.
Good morning.
So there's a story out there this morning that the United States may be considering more screenings at airports in this country as people from West Africa come in. Can you tell us about that, what you know about it?
CDC's #1 priority is keeping Americans safe from threats. We'll look at anything that could increase the safety of Americans. We want to ensure that, first off,
Well, won't you look at shutting airports down, smartass?
we recognize that facts are facts, and nothing we do is going to be 100%. As long as the outbreak is going on in Africa, there's the chance that an American returning or somebody else returning and coming here could have it. That's why we're working with doctors, emergency departments, and others so they rapidly identify anyone who might possibly have Ebola, isolate them, and test them as appropriate.
So it's been suggested that perhaps at airports in the United States, they might ask people coming in and out the flights, did you have contact with anybody? Or they might take their temperature. Anything else like that?
Won't you shut the flights down from going over there? Oh no, corporate wouldn't get their money then, would they? Simple fix, guys. Stop flying the damn planes over there.
We're certainly looking at those possibilities and others as well. Nothing's off the table in terms of keeping Americans safe, except
Nothing's off the table. But not going over there. We got to keep racking them dollars.
doing things that might actually backfire and make Americans less safe.
Okay. Doctor, we appreciate you being here. Obviously, this is a busy time for you. We understand that today, this afternoon, you're set to meet with the president face-to-face and discuss next steps. Would one of those steps be if a person has come from an Ebola-infected area, they're attempting to travel into the United States, and they have been in close contact with someone with Ebola, would that person, upon you recommending this, be prevented at least for 21 days from entering?
We're going to look at what might work, and our top priority is to keep Americans safe. That's what CDC does 24/7. So we're going to look at the possibilities and ensure that whatever we do works.
But it's got to be an action word, because while you're looking, people are getting extremely worried. So I think a plan of action, I was really hoping that you'd bring to the table today instead of continuing to say, I'm looking at it. Let me bring something else to
Well
to the
said
table.
there, buddy.
First off, in Delaware, what's the latest you can tell us? And after that, would you please tell us why more people can't get this Canadian drug that seems so effective in other cases?
We've already had well over 100 people considered possibly to have Ebola. You know, there have been about 40,000 people entering the U.S. from these three countries over the last 6 months. Only the one individual in Dallas has had Ebola. In that situation, the authorities there are doing an excellent job tracking every single contact. We have no other individuals who are at this point confirmed with Ebola. We're going to have rumors, we're going to have suspicions, we're going to have possibilities.
So there's nobody in Delaware that you're looking at right now?
In terms of a traveler, not that I'm aware of, no.
Right.
Full of shit.
Our top story this morning is that a child has died from the enterovirus, and it does seem to be spreading. And a lot of people, Doctor, I know the CDC is looking at this because we've never, in this country, in recent history, we've never had such an outbreak where so many people are so concerned. What is being done to stop it?
You know, anytime a child dies, anytime there's a preventable death, it's a terrible tragedy, and our hearts go out to the family. We're still learning about enterovirus. There's no vaccine for it. We know that if a child has asthma, it's really important to get the asthma in good control, because the kids who have been sickest with enterovirus have had asthma. Now that flu season is starting, it's important to get a flu shot, because kids with flu can get other infections, and that can be a real problem. And washing your hands, covering your mouth and nose when you cough or sneeze, not going out when you're sick, these are common sense things that can really make a difference.
Doctor, do you see either Ebola or enterovirus as taking that #1 slot in terms of priority for you right now? What should Americans be more concerned about at this time, today?
Football?
Right now?
I understand that Americans are scared about Ebola, but you have to put it in perspective. There will not be a large Ebola outbreak in the U.S. We stop it here by public health measures that track patients, as is being done in Texas, by hospital infection control that, if done right, will prevent any healthcare workers from getting it. We're not going to have the kind of outbreak here in any way, shape, or form compared to what's happening in Africa.
Will Mr. Duncan in Dallas get a chance to get the Canadian drug that's supposed to be effective against this?
We don't know if ZMapp works, but the hard fact is there is no more of it in the world. So it's not available. The company's working hard to make more, but it's hard to make, and that takes months.
Well, we know that you got your hands full. You're awfully busy these days. So Dr. Tom Frieden, we thank you once again for joining us today from the CDC down in Atlanta.
Thank you.
Thank you very much.